welcome to Let's Talk About COVID-19. Today, we're talking with a couple doctors who I have a personal relationship with. So thank you, friends, for being here. I'm excited to explore COVID together and explore the impact that it's had in your field and in your lives. So first, let's do introductions. So I'm Jessica Bledsoe, and I am the Executive Director of We Care Ministries. I'm a licensed clinical social worker, and we are just doing some interviews, taking time to explore how COVID is affecting our communities. And so today, I'm really honored to be with Melissa and Jessica and learn a little more about COVID in the context of medical care. So Jess, why don't you go ahead and introduce yourself?
Yeah, thanks for doing this. I'm Jessica Edgecomb. I'm a physician in the emergency department at the University of Wisconsin in my second of 3 years of residency.
And I'm Melissa Winter. I'm a podiatrist in Fort Myers, Florida. And I've been in practice now for a little over 2.5 years.
So this is our first pandemic in your professional lives, and first pandemic in a long time for all of us. We're all new to this. Tell me, how are you doing with all this? First I wanted to ask about how you're doing personally before we hear more about the logistics of things and how maybe your professional lives have changed. But how are you doing now? We are, 8 weeks maybe into some sort of social distancing and self-isolation, and it's been over a month now, maybe a month and a half or 2 months that we've been doing this. So how are you doing? Jess, how are you?
I'm good. I think in the same way that it's been strange for everybody, it's been strange for healthcare providers too. There's no going into medicine and going into emergency medicine. I've studied a lot of pandemics, and I think I've thought about, what would that look like practically speaking? What would that look like professionally? And in a lot of ways, I don't think you can anticipate. I think it's really different living it out. It's challenging without an end date. So I've definitely noticed a disruption of my routine, which has been, if it's possible to say that there's been a rhythm to the disruption now, but it's just been a challenge, I think, trying to figure out a new normal in this time of social isolation and navigating something that we haven't done in quite a while since the SARS outbreak in the hospital. So.
Yeah, definitely. So this is something totally new. And so even for the healthcare field to be dealing with this, I spoke with teachers earlier, and it's totally new, virtual learning. We're all social distancing, which is totally new. And so, yeah, even in the healthcare world, I like how you hit on their routines. That's something that we know is very helpful with our mental health, is having a routine. And so when that's disrupted, a lot can be at stake. A lot can feel different and unsure. And yeah, so thanks for sharing that. What about you, Melissa? How are you doing?
Everything's been going pretty well. I think I would agree with the same idea of, it's kind of trying to get used to whatever our new normal is. I think maybe the thing that's been a little bit different in private practice is that, at least in the beginning, really not having any idea how is this going to pan out, and we still really don't, is that, the initial fears. And so my schedule some days would be completely full. Other days, maybe I had a half day because so many people called and canceled. And so trying to figure out, okay, what do I do with this extra time? When you're a physician and a lot of professionals, you've kind of got that definite schedule that you follow every single day. And then now you're saying, well, what do I do with the time? So yeah, we've been kind of trying to figure out around our house how to end up staying away from the news to a certain extent, trying to really just focus on when you're home, you're taking care of yourself, and when you're at work, you're taking care of your patients. So.
Yeah, so you're still practicing that compartmentalizing and helping with some of that routine that maybe you have had before. it was interesting how you brought up the difference between private practice and being just in the public hospital. So Melissa, I know you and I had a conversation a few weeks ago where the hospital near us, so elective surgeries were canceled. And so that affected part of your work. That's part of that change that you have.
Now the big thing has been, when you do go to the hospital, the different regulations of how you're supposed to protect yourself, protect your patients. And then the same for elective surgery. They've been changing, you're supposed to now wear 2 masks as opposed to 1, and some of the changes for that.
Oh, wow. Tell me a little more about some of those changes that you have with the elective surgery even.
So elective surgery just started this past week that we've been able to. And so you can start to schedule, but they've only increased the number of cases by about 25%. So we actually haven't seen a big increase in elective cases because there's still trauma and add-ons that come in. So the majority of what I've been doing right now have been fractures, infections, that kind of thing. But then now what they're starting to talk about is it depends center to center. So some of the private centers are wanting for the patients to have already been tested for COVID and being negative prior to being allowed to having anesthesia and surgery. Some of the changes have been, patients have to be under a certain age, not have any other prior medical history, a lot of the things that would put them more at risk. And then depending upon where it's done, if it's done in a surgery center, people still go home the same day, of course, but then at the hospital, we really haven't started doing a lot of same day surgery yet, just because the hospital's still busy enough on its own with their own emergencies.
Gotcha. Yeah, Jess, how is that looking for you in the hospital? How have the changes been?
It was actually interesting. So when things first started happening kind of towards the end of the winter, we saw sort of our normal volumes and interspersed people with respiratory illnesses. It was still influenza season and RSV season. So you saw sort of your run-of-the-mill viruses, and among that, probably saw more COVID than we realized. We just weren't really, it wasn't on our radar. We weren't testing for it. Once the social distancing sort of gained more national recognition and people started to do it and became enforced sort of throughout the country and not just in the hard-hitting cities, all volumes in the hospital went down, but particularly in the emergency department too. And so what we saw were a lot fewer patients coming in, but a lot sicker patients. And not sick because of COVID, sick because I think, the emergency department is this place that's sort of a catch-all for healthcare. So it's a gateway to the hospital for a lot of people. And I think a lot of that was getting diverted to televisits, people, going to their primary care physician for more run-of-the-mill things. I think a lot of patient fear has kept them at the emergency department. But in addition to having people that are sick with COVID, we still have, people still have heart attacks, people still have strokes, like they get in car accidents. And so I think on the whole, while our volumes have been much lower, we're sort of seeing a little bit more distilled emergency type of population. Now, as things are slowly starting to roll back, our volumes are picking up. In the hospital, we had sort of gone to this model of staffing that was trying to preserve resources kind of prophylactically before we got hit with a big wave. And so we were able to sort of split staffing into oftentimes 2 teams that would work, 5 days on, 5 days off. The emergency department is the exception to this because we all just kind of worked our normal schedule. But trying to minimize contact with patients so that if we were to have a higher, more tax on our healthcare system, that we could be prepared for that. Now things have started to go back. So we just started also slowly are letting elective surgeries happen again. Slowly starting to let clinic visits, and there's still pretty strict stipulations. So for patients, anybody who has a respiratory illness and wants to go to a clinic visit, they'll try if they can to convert it to a telehealth, and there's more screening questions, but it's kind of or making steps towards, I think, what people were familiar with in terms of accessing care but we're not, it'll be a while, I think, before it's completely back to normal.
So how do you think things will change? Like, how can we prepare ourselves for the healthcare system just to look different? Do you have any idea what some of those changes that we should count on kind of sticking around?
It's hard to say. I think as much as I think being cautiously optimistic is a good mindset going forward, but in the same way that, I've heard a lot of public frustration of people who are just like, well, the guidelines change every day, and what people recommend for PPE and social distancing and how many people you can see and who you can see changes very rapidly. The same is true in the hospital. So we just, for a while there, we had to say that all family members, unless a patient was critically ill, were not allowed in the hospital, so we didn't accept any visitors. And now we're letting one visitor per patient per 24-hour period, and sort of stepwise adding things in. I think people just have to be prepared to not hold on tightly to that, because, if we see a surge in cases, some of that might have to be scaled back. If things continue to go well, then some of those freedoms will be released again. And I think it's just a little too early to tell how it's going to go.
Mm-hmm.
There's some things that I hope will stay, like the ability to be able to do telemedicine visits. Not everybody needs to be seen in the office to be able to treat them. In the past, a lot of people will end up coming in for the lab results or coming in for biopsy results. A lot of those things could be done over the phone and be done over the phone well. The other thing that I would say is, like what you were talking about, the idea of family members not really being in the hospital. We're still in that situation right now, and it's been really hard, especially a lot of my patients are older. And so people who are going in for surgery and now their loved ones aren't able to be there, or people who are really sick and their loved ones aren't able to be there, that fear that they may not see them again. And that's something that I think that the humanity part of medicine and the part of being able to be there for one another, it's going to come back. It's just a matter of when, and it's being okay to be patient right now, that things are constantly evolving and we have to be willing to evolve with them. But some of the other stuff, they've talked about that infection rates are lower for other types of infections because of the precautions we're taking. And so I think that this has raised a good awareness that we all need to be doing a better job of simple things, washing your hands, and just being a lot more cautious before going and serving somebody else food, those kinds of things. We've already known those, but I think that it brings it much more to the forefront.
Mm-hmm. It was also really interesting. I had a conversation, I think within the same week, with both of you individually. And Jess, you were saying you had lower numbers in the ER at the start of this, at the beginning of our social distancing. And Melissa, you were saying that more people were coming to your office with things that they might have gone to the emergency room for. And you were hoping that maybe this is a lesson we would learn, that to go to a specialized doctor for a need instead of burdening the emergency department in our area. Can you, Melissa, talk a little more about that?
Yeah, so, especially when I was going through training, there was always this conversation that, people go to the urgent care or go to the emergency room basically for everything, and so when in reality, urgent care and emergency room is really more aimed at the idea of stabilizing you, getting you the help you need, but then sending you out to who's going to be able to treat you. And so the interesting thing I saw is, I've seen a big increase in the number of fracture patients who have just been coming straight to the office as opposed to going to the ER or even going to the urgent care and saying, I bumped my foot in the middle of the night, or, I ended up, I tripped. Those are things that could wait until the next morning. And that way it ends up, especially in in our area. You know, Lee County has a very high retirement population. And so because of it, every year when what we call the snowbirds, everybody who comes down here from up north to spend their winter in the sunshine, you know, when everybody's here, our ER is really just at maximum capacity. You know, oftentimes patients tell me that they've had a 4 or 5 hour wait. And they've had a 4 or 5 hour wait because there's still emergencies coming in on the ambulances that get moved to the forefront. So yeah, I'm hoping that people will start to realize maybe you didn't need to sit for those 5 hours. You know, it probably could have waited until the next morning and be handled basically to the same extent. So
yeah, Jess, do you have anything to add about that? Just our idea of maybe what constitutes an emergency?
Yeah, I think kind of like Melissa said, a lot of problems can be managed very well outpatient, and oftentimes that's what we will do, is refer to the patient to their outpatient provider once we've made sure that, you know, nothing big and scary or life-threatening is happening. I just caveat it with, I don't want patients to feel like the emergency department is not there for them still. I've had sick patients come in who have apologized for being there, who have, you know, waited probably longer than they should have before seeking care, because they were afraid. They didn't know, you know, they were afraid of exposing themselves. They were afraid of burdening the health system. And we're kind of walking this line of wanting to be good stewards of our health resources, of our healthcare system, but at the same time, I think sometimes that can be taken a little too far. And that was initially my first concern when our volume dropped, was, are there people at home who are really sick and aren't coming in because they're afraid? And so it's just sort of walking that line of realizing that some people are, you know, for the most part, great self-triagers. You know, people can tell when, you know, if they feel like their blood sugars have been high but not too high, and they can call their doctor and discuss that over the phone, you know, adjusting medications like insulin. Whereas things like chest pain or weakness are things that really should have an emergent evaluation, and I don't want those patients to feel that there's a barrier to them getting that care.
Is there anything we need to be aware of in regards to symptoms and maybe being tested for COVID? You know, are there any precautions we need to take, certain people we need to call before going in, just the emergency department? I know it sounds like every hospital is kind of managing it different, and every state has their different rules and the ways that they're testing. So what are the respective ways in your respective areas that the testing is happening, and knowledge we should have about that?
Yeah, so for Wisconsin, we are at a place where we have access to rapid testing for pretty much anybody who's symptomatic. So the symptoms that we talk about and expect to see are any fever and then respiratory symptoms. So a cough, chest tightness, any difficulty breathing, a sore throat, body aches, extreme fatigue, coupled with a fever. Those are kind of the presenting symptoms. You will hear of some people talking about, you know, an upset stomach, some GI symptoms as well, but that's probably less common. It's more the fevers and the cough and the chest tightness, I think, that people are coming in with. You know, if you feel like you have symptoms that that you want to be evaluated for, at least here we have, for our outpatient clinics, you can call ahead and they do a screening exam on the phone. And if you're positive, we actually have a drive-through testing window. So you don't actually have to get out of your car. You can just drive through. And for certain patients that this is an appropriate pathway for, their primary doctors will just go that route and have them be tested that way. If you ever feel though that you are having difficulty breathing, or you feel like your symptoms aren't manageable at home, the emergency department's a fine place to come. You know, we're happy. We have access to testing there too, and can sort of help you decide if an admission versus home is the best place for you. And that's mainly going to be your older population. So, you know, that people who have medical conditions at baseline or immunosuppressed or elderly, that's probably another route that they might go down. Otherwise, I think that our primary care clinics have been great sort of directing people of where to go. And most people can get tested here as long as you have a symptom.
Great. What about in our area, Melissa, in Florida?
So we just this past week ended up having a testing site open to where you don't need to have a doctor's order, you don't need to have symptoms. And so that is more for the person who just says, hey, I think that maybe I've got something, or I think that I was exposed to somebody who was diagnosed. And so they are limiting it. I think that it's 500 tests a day. And so when it first opened, it was really, really busy with the initial rush. Now it's kind of started to settle down a little bit more. So there's that avenue, but then there's still the avenue of being able to call your primary care, or go to an urgent care, go to an emergency room if you do have symptoms. What they've really been encouraging is that if you do have symptoms, but you're stable, to talk to your primary care. However, if your symptoms are more aggressive, especially if you're having difficulty breathing, then they're recommending just go straight to the emergency room. And that's more the way that they've been trying to triage at this point. But now with them taking and opening up to where you don't need symptoms, there's a lot wider spread testing that's occurring. So.
Great. What do we need to know, maybe in regards to the ways that we can continue protecting ourselves and kind of staying safe as it seems the world begins to open back up? I know around here in Florida, we drove by churches this past weekend that had parking lots full, and restaurants are starting to open back at a certain capacity. So what should we know moving forward? I know we've touched a little bit on some things we hope continue, like the hand washing and that sort of thing. But do you have any ideas of other things that we need to just be aware of and mindful and prepare for continuing as we move forward?
I would say the biggest thing is just, with everything constantly evolving, try to at least pay attention, if even just for 15 minutes a day, listen to your local news to have an idea as to what's going on in our area. Things are changing so rapidly that the guidelines, one day they're opening the beaches and the next couple of days, maybe they don't think that that's smart anymore. So I think knowing what's going on in your local area is going to be really important. And then past that, I think a lot of it's going to be, really doing what do you feel comfortable with. I've had a lot of my patients, I see a lot of patients that are older that are saying, the only people that I'm seeing is you and my significant other. I think that for them that's smart, especially since I treat a lot of diabetic patients and people with other comorbidities. They need to be wise about who they're exposing themselves to. I also think that our younger population needs to be wise too, to not be going out and, having parties or that kind of thing. I think the most important thing is trying to be respectful of one another, trying to understand that there's a lot of people right now that are really scared. And so, just being there to support one another is important.
Yeah, I agree. I think a lot of the common sense measures that have been employed, I think, are things that going forward we should do. Doctors are guilty about this, working sick, but this has helped change our culture of, if you feel sick, don't go to work. If you feel under the weather, this isn't the time to tough it out and prove that you are going to push through it and not let people down. I think checking in with yourself more frequently and monitoring yourself for symptoms. And if you feel some, stay home. If you, as we start to go back to life, coronavirus is spread as a respiratory droplet. So the things that you'd like to think everyone does, but cover your mouth when you cough, wash your hands when you cough. Don't share drinks with people that you're not normally sharing things with. A lot of it is frequent hand washing, not to be afraid. You're not going to just walk through an empty park and contract it by breathing in the air. So I think some of that fear should be lessened, but also realizing if you are within 6 feet of somebody who's coughing, you can breathe that in. And so just trying to limit, if you're in big gatherings, wear your face mask. Just kind of be a little more aware of the people around you and of yourself. And I think quarantining, like Melissa said, based on your own risk category. We see it. I was talking with you, Jess, about this, how you were quarantining before it really even kicked in because you just had a baby. And, we look at newborns and we recognize that they don't have developed immune systems. And so parents instinctively and are told by our pediatricians, keep them home, avoid, especially your baby being born in respiratory season, keep them away from large churches and large gatherings because they're at risk. I think the same thing, it just may be in a different season than we're used to, right? Because we always think of the winter as when people get sick, and not so much these spring and summer months. And I just think kind of carrying forward that common sense would be useful.
Mm-hmm. Definitely. And I know both of us, all of us have had our plans change because of this. Jess was going to come spend a whole week with us in Florida, and we had to postpone. And Melissa was going to come over for brunch and meet the baby. And it happened to be the day before or the day after when I was watching the news about the first COVID death in Lee County. And it's like, Melissa, I think we should postpone. So yeah, it's been definitely a long road that we have been on so far. How can we be a support for our healthcare providers? Jess, why don't we start with you?
Truthfully, I feel like we've gotten so much support. I've been really moved. I went into emergency medicine for a time like this. I wanted a skill set that if something were to happen, if people were to get sick, I had something useful I could do. I think I get a lot of purpose out of action. And so in a lot of ways, having my job still there and something that I can tangibly do has been really helpful for my own well-being and mental health. So that said, I don't expect any accolades or support for what I feel like is just doing my job. But I've been so moved at how many, local businesses have made scrub caps for us or made masks for the community or brought us food at the hospital. On a more personal level, I think just checking in. I know that we've talked probably more during this quarantine than we have in a while, just using that time to connect and gives people space to say that this kind of sucks too, that it's funny. I liked what Melissa said about time and having more time than we're used to. As a resident, if you ask a resident what they want, we would always say more time, time away to just do our own things. But I felt really guilty having a lot of free time and not being able to use it in what I thought was a productive way, or what I thought was, I have all these plans of things I'll do when I have more time. And a lot of that I couldn't do even though I had the time. And so I think giving people spaces to just voice that or fill their time with other things, fill their time with connection, even if it's virtually or planning when I'm actually going to see Hardin and things like that, have been really useful.
That's awesome. Melissa, what are ways you think we could support our healthcare providers?
I would just second. It's been amazing what communities and worldwide people have been doing for their healthcare providers. I mean, I would say that on a daily basis, patients coming in and saying thank you even to, the ladies sitting at the front desk. People just seem to be extremely grateful, and just saying thank you for us being available. But I would also second, this is what we signed up for. I don't think that anybody really goes into healthcare, without wanting to take care of people. And this is just a continuation of taking care of people. So I would agree, checking in, making sure that, we've got someone to talk to as well. It's been amazing. I've had friends that maybe I haven't talked to in months or years calling and just saying, hey, I was thinking about you and wanted to make sure that things are good. But I think the biggest way is just going to be, really the best way that you can support us is to continue taking care of you, and taking care of your families. That's going to make it to where everything's a little bit easier for everyone involved.
Definitely. Well, and thanks for being here with me and voicing some of your experience and your hopes and the things that you've had to manage in a new way. And I'm so grateful that we were kind of able to be that place that Jess was saying to kind of check in and see how things are going. So I'm so honored that you took your time to be here with me, and I'm happy we get to share our conversation with others.